So we should be able to test this hypothesis. Some of us being academics, so if we have a hypothesis, how would we test that? Well, what about the converse? Does it therefore mean if we spend more on primary and community care that we would have lower costs, better outcomes, and higher quality? And indeed, when we look at that, that's what we tend to see. So this is Barbara Starfield's, the late Barbara Starfield's, some of her seminal work, showing, and I apologize to the purists, she mixed up the axes, she has mixed up the dependent and the independent variables on this graph, but basically pointing out that health systems that are more centered around primary care will have lower costs. Or alternatively, because hospitalization and hospital utilization is the main driver of our costs, the number of care providers that are primary care providers versus specialists in a healthcare system, the higher that proportion, the lower the hospital admissions, and therefore the lower the costs. Well, this is Alberta data. Does this apply to Alberta? So we've looked at the use, and so at number of hospitalizations, the length of stay, or the absolute healthcare cost for patients in Alberta. Now, this is that top 5% of users. And one of the things that we see, in keeping with this theme, is that those who do not have a regular primary care provider, that's the red bars, they hugely are overrepresented in the most frequent users, people who have the longest length of stay in hospital, or people who have the highest cost. If you have a primary, one of these people, if you have a person who sees a primary care provider most of the time, or the majority of the time, greater than 75% of the time, you can see comparatively a much, much lower, an 8 to 10-fold lower rate of hospitalization, rate of length of stay, or total healthcare system cost. But wait, special only today, if you act quickly, even more data. If we look at our patients and we divide them by clinical risk grouper, which is done in many, many jurisdictions, it's basically severity of their clinical condition ranging all the way from healthy, all the way to people with multiple, 3 or more multiple chronic conditions or a catastrophic illness. And if we see which one of those have a family doctor and how often they see the family doctor or other primary care provider, this is what we find. We find that the more they see, if they have and see a primary care provider, the lower the costs. And in fact, what we find is that the more complicated they are, the more they benefit from having a primary care provider. You can see, in fact, that the most costly are those in the pink, 3 or more chronic conditions. And this is a logarithmic scale. It's not a linear scale. So in fact, not only are the slopes of the lines increasing, but with the logarithmic scale, it means that the more complicated you are, if you haven't seen a primary care provider, the lower your costs, both in relative and absolute terms. You can take somebody who has $50,000 a year and make them $10,000 a year if they're one of the more complicated patients. Healthy patient, about $500 a year to $400 a year. So everybody benefits, but the more complicated you are, the more you benefit. But if you act in the next 2 minutes, and we have operators standing by at www, I'm not kidding, edmontonareadocs.com or www.calgaryareadocs.com, and if you don't have a primary care provider, in the next 2 minutes we can get you one for free. What better deal can you get? We can also decrease your risk of death. And so this just came out a couple of weeks ago from Alberta Health, pointing out that if you have a close attachment to a primary care provider, your risk of mortality is decreased if you compare to if you don't have a primary care provider. Therefore, end of chapter 1 quiz. What is the most effective thing we could do in our healthcare system to decrease costs and improve care? Have a primary care provider, be attached to a primary care provider.